Greetings, friend. It's Dr. Megan here, your favorite naturopathic doctor. So I've been working these past couple of Thursdays, and I completely forgot to do a few videos. Also, we're going to try to catch up on this one. This month, we've been talking about the fifth killer of Americans, which is mental health diseases, specifically anxiety, bipolar, depression, and post-traumatic stress disorder. We talked about some of the symptoms of those in the other video. Anxiety is just, again, being very anxious, even though most other things in your life are going fine as far as your jobs and your loved ones, etc. Bipolar, we said, is like a swing from needing no sleep and being very hyperactive to being very depressed. Depression is, again, just having zero desire to do any of your normal activities in life, eating, hanging out with friends, etc. And then post-traumatic stress disorder is having gone through a life-threatening event. It could, again, war veterans is a common example, but it could have been a car accident, it could be cancer, whatever, something life-threatening. And then your brain just can't process it and it replays it. So today we're going to talk about how do you diagnose it. To be honest, since both of them are considered mental health diseases, there's no direct marker to alert a doctor that this is your issue. Of course, they'll do thorough blood work, should anyway, just to eliminate underlying diseases as being a cause for anxiety, etc. But otherwise, there's no specific marker. Now, in naturopathic medicine, anxiety, so we believe that the organs also have emotions. The emotion of the stomach is anxiety. So I've actually seen patients where, again, they have plenty of money in the bank, their family's fine, there's no issues, and they're still very anxious. We would usually look at the stomach. For bipolar, again, we consider, again, a gut issue. So now we're doing a lot of gut testing, stool analysis, etc. Depression, same. Post-traumatic stress disorder is a little different because we would consider that to be, again, the main event. That would, again, have their basic, very thorough testing. Again, your Carol to eliminate toxic foods, thorough labs, your stool analysis, omega-3s, amino acids. However, with post-traumatic stress disorder, we need to also address the mind because that's really where the main issue is, and which I would refer them to some of my mental health support specialists to assist them in that. But that's it. So please see my website, healthorganizers.net, for more tips. And I'll see you on the next one.